Also, as you mentioned, we are also seeing a large number of cases of RSV this season, really more than we've ever seen. Now, RSV is a very common respiratory virus that affects young children. And while most children will have typical cold symptoms such as cough and congestion, some children, particularly the first time they have RSV, can have a more serious illness. This infection can also be more serious for some children, including premature infants, babies less than 6 months of age, and those with underlying health conditions affecting their heart, lungs, or immune system. We are seeing more kids this year with severe infections due to the fact that RSV cases were extremely low in prior years due to the masking and other infection prevention measures to reduce the spread of respiratory viruses. Now, children older than 2 years of age are being hospitalized for RSV. There are measures you can take to prevent the spread of RSV. Preventative measures include things like hand washing, wearing a mask around vulnerable populations, and wiping down surfaces, particularly those that may have come in contact with respiratory secretions like toys and books.
We're seeing children who would normally have had their first case as infants getting the virus at 2, 3, 4, or even 5 years old now. Because they've never had RSV, they don't have the immunity and are experiencing more severe symptoms. Many are being hospitalized. Many are also needing increased levels of treatment. Children's hospitals are getting full, and that, combined with an expected heavy flu season and COVID, is that triple-demic that people talk about. So if your child does show symptoms of RSV, take them seriously. In infants, those symptoms can be runny nose and congestion, loss of appetite, or a cough that might turn into wheezing. Older children with RSV can have a runny nose, a mild fever, a cough, or a sore throat. If you see symptoms of a respiratory illness, talk to your pediatrician. Keep in mind that emergency rooms might not be your best option for care. I can say that across the region, the emergency rooms have been exceedingly busy over the last few weeks. If you can make arrangements to see your primary care provider or pediatrician, or make a virtual care or telehealth appointment for non-urgent needs, that can be helpful. If the need is more time sensitive, urgent care facilities might be your best option if it's outside of normal hours. We're really hoping to keep the emergency rooms freed up as much as possible for the most acutely sick children during what is already a very busy time.